Now, there's a bill before the Senate, and this has been proposed by nominated Senator Catherine Muma, that is the Tobacco Control Amendment Bill of 2024. The bill is seeking to amend the current law, the Tobacco Control Act, and further regulate the production, sale, advertisement, and smoking of nicotine products. That's both natural, that's tobacco, and synthetic, including the use of nicotine pouches, packets containing powdered nicotine, and electronic nicotine delivery systems like vapes. The bill prohibits the manufacture, importation, distribution, storage, or sale of nicotine products without the prior approval of the Cabinet Secretary for Health. It also restricts the manufacture, distribution, marketing, sale, and use of electronic nicotine delivery systems, the refill containers, and nicotine pouches. It also restricts the advertisement of tobacco products, electronic nicotine delivery systems, and nicotine pouches. It's a wide bill, basically seeking to catch up with the times, because we already have a law that is strong on control of tobacco use. Now this one is seeking to amend to catch up with the times. We are joined by Dr. Kariuki Michael, who is the Secretary General of the Harm Reduction Society of Kenya. He's here with us in the studio. And virtually, we have Wambui Mbarire, the Chief Executive Officer of the Retail Trade Association of Kenya. Wambui, let's start with you. Good morning, and thank you very much for joining us for this conversation.
Good morning, Eric and team. Happy to be here. Unfortunately, I couldn't make it into studio this morning.
It's all right. We're glad to have you. And Dr. Kariuki, karibu sana kwa studio.
Good morning. Thank you very much.
We fix the nation here one conversation at a time. You'll explain to us what this bill is seeking to do and what the Harm Reduction Society is and your views on the bill. But first, we start with the day's quote. Jano Amakot is going to give us a quote. Somebody said something some time ago. Let's see whether those words make sense today. So Jano, you'll start with Dr. Kariuki and then go to Wambui.
Right, yes. Tsitsi Dangeremba, who is a Zimbabwean writer, filmmaker, once said, when the structures are sick, the people cannot be well.
Absolutely. That simply means that when you get it wrong from the word go, then nothing will work.
Nope. It can't work. Plain and simple.
If you start wrong,
yes, the rest
you will
follows.
end wrong.
Wambui, do you share similar sentiments?
Yes, I do. Case in point, our conversation today, if we don't have structures to implement what we are putting into law, it won't cure the system.
Wow. I can already see where she's going with this.
Yeah.
I can already see where she's going with this. Let's start with you, Daktari. This bill before the Senate is seeking to amend the current law, which has serious restrictions on the sale, advertisement, consumption of tobacco products, hereby known as cigarettes. So what's the new thing that this bill is seeking to include into the control?
Right.
Yeah, thank you very much. Let me briefly give a chronology of events as to where this law came from. And way back in June 2004, the World Health Organization did come up with what we call a Framework Convention for Tobacco Control. And that was a year before. And in 2004, Kenya ratified that convention. It's a treaty that regulates tobacco products, all aimed at protecting people, because we know tobacco is legal. It's not an illegal product. Then some 3 years down the line in 2007, Kenya enacted the Tobacco Control Act. And during that enactment, that is where we got it all wrong. Because the reason I'm saying that is the Tobacco Control Act was actually lifted from the Framework Convention for Tobacco Control. And there was one very key omission that was omitted in the Act. And that is the definition of tobacco control as defined by WHO, which essentially means a range of supply, demand, and harm reduction strategies that aim to improve the health of a population by eliminating those harmful effects of tobacco. So in the definition of tobacco control, which was omitted in our Act, it did recognize very well how to go about protecting people because you target the demand, supply, and at the same time you introduce harm reduction strategies. What the Act did, it focused a lot on the demand and the supply aspect, and omitted, the harm reduction strategies. And that is where we went wrong. Many years down the line, the tobacco sector has really evolved. And we have lots of innovations coming out. And one of those innovations is electronic cigarettes, or what we know as vapes, or nicotine pouches. And one of the things that we need to recognize, even as we move along, is that there is a very clear distinction between nicotine and tobacco. Tobacco is not nicotine, and nicotine is not tobacco. Tobacco contains nicotine. Just like the potatoes you eat at home, they actually also have nicotine, and other vegetables have nicotine. And what the Act and the new bill is trying to achieve is to equate tobacco to nicotine, which is not right from the word go. WHO has clearly stated that nicotine is not carcinogenic, and that is why we have medicinal products that have been approved by WHO to assist smokers to quit. Electronic cigarettes have been with us for more than 20 years. And they are evolving. The sector is really evolving. The nicotine, other nicotine products are really evolving. And it is high time that we get a law that regulates these new products, especially so that we protect our youth and children. I know enforcement is a big issue, and that has to be addressed because we already know in the Tobacco Control Act, which clearly stipulates how enforcement should be. Very little is being done, and as a harm reduction society, we are telling the ministry, in as much as we create these laws, if there is no proper enforcement, then nothing much will be derived from this.
It comes into the enforcement, and that goes into the supply side, right? That then controls how demand is addressed. Wambui deals with the supply side as a retail trade association. Retailers, Wambui, from 2007 when we came up with this new law, what changed, and has it had any effect in terms of access to tobacco products?
Thank you very much. I would say not much changed, especially in terms of what is in the market. What we see is where there's an attempt to enforce some of those laws, we find that the illicit trade is growing, meaning we're creating more dark spaces in net places. So in the formal sector, we've managed to kind of live within the law. I keep repeating, there's a law that says, as retailers, we shouldn't be selling single sticks of cigarette. But as mentioned, that implementation of that is quite the challenge. What we've seen is, as I said, the growth towards illicit trading of cigarettes in an attempt to circumvent that law. I think Doctor has said something very interesting, that we got the implementation, or we got the law wrong from the beginning. So what we've been trying, perhaps by the various amendments over time, is to correct what was already wrong. Doesn't that compound the issue further to creating new amendments? I love the fact that that he has talked of the distinction between nicotine and tobacco. Definitely there is need to bring in the new developments into law, because we must regulate how it is consumed. And maybe that is what we should be focusing on, vis-a-vis focusing on the existing laws around normal tobacco. Yeah.
When you say, okay, focusing on the newer, products and what's coming up, as opposed to regulating already what's happening with tobacco, the obvious pushback will be that, as you've said, even as far as tobacco regulation is concerned, we've really not hit the head. So then what's the fix there before we even now move to new products? What's the fix there to ensure that, no one is selling tobacco in sticks. We're following 2007 regulation before we come to 2025 regulation. And that's as far as tobacco before now we get into the nicotine conversation.
The fix would be in instituting the implementation measures that are captured within the Tobacco Act. Failure to implement will not be cured by amending and putting in another law. So private sector, together with government, the industry players, need to work together to find a way to implement that which exists, because even the tobacco industry itself is keen to ensure that we manage who has access, who's smoking. So together we can work together on the implementation. I repeat again, creating another law doesn't enhance the implementation. It probably just complicates the implementation processes. So let's take the laws that are already there, some which are already again mentioned in the new amendments, and work together to implement that, to manage the consumption of tobacco.
I know, Wambui, I'll come to you later to just talk about the impact for small traders who rely on, some of these products for their daily bread. So you can come and speak to that later. But Dr. Kariuki, I wanted to go back a little bit to the patches, the e-cigarettes. Some groups say these actually help smokers quit. So I'm wondering whether they can be encouraged as healthy alternatives as opposed to there being any heavy regulation on them. I just wanted to get your thoughts on that.
Yes, thank you. There is copious amounts of evidence, scientific evidence, that points towards these products being safer. I'll just quote a few. In the UK, they did a study which actually showed that these products are 95% safer than tobacco. That is irrefutable evidence. We have Cochrane studies that have studied more than 30,000 smokers, and the constituent products in these particular safer alternatives that have shown that these products are actually safer than tobacco. We know tobacco has more than 9,000 carcinogenic substances, which you don't find in that proportion in these safer alternatives. In fact, as a matter of fact, in the UK government, funded by UK taxpayers, is implementing a program called Swap to Stop. And in this program, you walk into a stop smoking services department, and they actually give you a free electronic cigarette that is regulated by the government, and they tell you, quit your tobacco, start using this, come to this clinic for follow-up, we will assist you to quit. There is a lot of evidence to show that these products can actually assist. And initially I said that WHO has outlined nicotine products in their list of essential drugs, such as nicotine patches, nicotine gums, nicotine inhalers, nicotine lozenges. And the concept of these products is that what you are hooked to is the nicotine when you're using the tobacco. And the same can be used to actually manage your addiction until you quit. And this is a concept that has been with us. Those people who are afflicted by, let's say, the opiates addiction, the IV drug users. We have a program called Methadone program where they are given an equivalent that is safer that assists them to quit. So this concept is actually working. And what we are trying to tell the government is that we cannot have a blind eye on scientific evidence.
Right. So the rates of smoking gone up in recent years? And I'm using that anecdotally. I think smoking over the years has gradually reduced. That's just from anecdotal evidence. And then, because then the obvious pushback is for smokers, e-cigarettes, vapes, etc. are obviously useful in getting them to quit smoking. For non-smokers, though, it could be doing the exact opposite, which is now leading into a new form of an addiction. So yes, have the rates of smoking been going up or down as a trend in recent years? And what does it do for non-smokers when they do pick up vapes, e-cigarettes, etc.?
Thank you. Let me start by giving you statistics globally. For the last 10 years, the total number of smokers have stagnated at around 1.3 billion globally. What is interesting to note is that there is a shift of smokers, such that in the developed countries, those who are smoking tobacco are actually reducing, and we are seeing an increase. In fact, as we speak now, 80% of those 1.3 billion people are living in low and middle income countries, Kenya being one of them. When we come here to Kenya, in Kenya, we have about a total of about 3 million smokers who smoke. And the statistics that we are getting from the ministry is that the prevalence of smoking is reducing. But from our own analysis, we think that we are not achieving as much as we would want to achieve. The case in point is this. If you want to know whether something is working, you look at the sales from KRA and the other places, and you will find that the sale of factory manufactured cigarettes is actually increasing. And the question is, in as much as we are getting statistics that the prevalence is reducing, why is the sale increasing? I mean, it should be in tandem.
Per capita consumption is rising.
Yes. Then I'll also give you a very shocking statistics. NACADA did some work, and they proved that the smoking initiation age, actually the tobacco initiation age in Kenya is 6 years. 6 years. And they gave some of the reasons. People have resorted to smoking at home. People have resorted to sending their children to buy tobacco, to light the cigarettes and all that. Children are finding littered cigarettes, and they attempt to expose themselves to smoking. And what we are trying to say is that we need a concerted effort so that we bring our smoking prevalence down.
I want to go to Wambui and ask some of the key provisions of this amendment, and why specifically RETRAC, which is the Retail Traders Association, and BALITA, which is the Bar and Restaurant and Liquor Traders Association, are pushing the Senate to halt any further progress. But what are the key provisions of the bill?
So the key provisions of the bill is, one, it makes it illegal to sell cigarettes through hawking, through vehicles, through mobile vending, and any of those can result in, I think, a fine of about 50,000 or 6 months imprisonment. It makes it illegal for a person to advertise, and even the current law is such that BAT actually cannot, BAT, Mastermind, and those are the two main ones, cannot really Mastermind is no longer there. So BAT and the other guys who do Philip something cannot advertise, which as it is, they don't, in any online or digital format. It also makes it illegal to promote or advertise tobacco, either through influencers or ambassadors or the social media generally. And again, here we have, I think, a fine of 500,000 or imprisonment of 3 years or both. And then it seeks to ban flavors in nicotine products. And the bill sets to limit nicotine that should be in a nicotine product. And it seeks, and this one is the one that is quite heavy on the small traders, seeks to give county governments power to license the sale of tobacco. Those are our greatest concern, and that's why we put together the petition.
Right.
What do you have against advertising? The ban on advertising?
I think Daktari tell you, even in the existing law, it already forbids them from advertising.
Yep.
And it has to do with, you see, you want. I think so. If I'm not seeing it, I might not know about it. I might not try it. It's just limiting exposure of the existence of the tobacco products.
Right.
Are you saying?
And it's not me who has, Eric, and it's not me who has anything against it. It's captured in that law, in the one that it's already in law actually.
Yeah. So is there a pushback by RETRAC on the proposal here. The proposal in this law is to expand the spaces where tobacco advertising should not happen. That now also brings in the social media, because the previous law was talking about you cannot advertise, cannot promote, you can't sponsor, sporting events and so on and so forth. Now it brings in social media. Is RITRAC aligning with that?
Because of what already exists around tobacco, again, concerted effort, I think there needs to be a bit more consumer engagement in terms of using the definitions that the good doctor has used. If the root of nicotine would help reduce tobacco addiction, then maybe there is a case for talking more about the nicotine, which would give maybe a window to the industry players to be able to engage consumers around the benefits of benefits of nicotine as a way to reduce your tobacco consumption. So maybe there should be a window that allows for more advertising that is tailored towards engaging stakeholders and educating them around nicotine products.
Okay. We're about to go on a short break, but when we come back, maybe we'll go through some of the other proposals in the bill and see where exactly RETRAC, Balita, and the Society for Harm Reduction are thinking, where they're coming from as far as some of these proposals are concerned. But the hashtag is Fixing the Nation NTV. Of course, you can call in when we're back from the break on 0719-038-858. We'll hear your thoughts on the amendment to the tobacco control bill. Hashtag Fixing the Nation NTV.
Absolutely. Moses Kwereba Gaduas on YouTube is asking, are there statistics of e-cigarette or vape ETC in Kenya? Are our regulators aligning with the changing times? I feel like it's been alluded to somewhat, but if you could just get your quick reactions to that, Daktari.
Yes, as I initially pointed out, these products have been with us for more than 20 years, and it's high time we have some regulation that involves all the stakeholders with an aim, especially with an aim of protecting children and youth.
Okay. There's Macau who's sent a response here, says, please address the economic reality of most smokers. They buy single cigarettes because that's all they can afford on a daily, despite the law saying that you cannot buy single cigarettes. Also, e-cigarettes and nicotine products are expensive and few can afford. As long as we have laws that fail to be constructed in the reality of most Kenyans, they will drive a black market and the problem will not be addressed with elitist solutions. What's your response to that, Dr.?
Yeah, absolutely. That's why we need all stakeholders on board, because as I rightfully pointed out, we have a law that says you should not sell single sticks, but they are being sold anyway. And the question is why? Is it the enforcement bit? Is it the economic angle bit of it? So we need to get a solution, because we may have very good laws, but implementation becomes a challenge.
It becomes a big issue.
Yes.
What was the thinking behind, if I remember correctly, when Charity Ngilu was pushing for the initial bill in 2007, the thinking behind restricting purchase of cigarette to packets was to restrict access to the younger consumers. We're saying now the age of introduction is going down to 6, is to make sure that, people who are children and would not be able to afford a big pack of cigarettes, they'll be going to buy single sticks. And so let's reduce that by saying outlaw it. But clearly that's not what's happening in the society. So what would be the solution? What's the fix for that? Wambui, let me ask you that question, because you represent the retailers, the shopkeepers. What would be the fix for that? If you'll find that there are in some sectors of the market, the market demands you sell me a single stick or 3 or 4 or 5 because that's the money I have, and you're in business and you can sell. What would be the fix for this? Should we open up that law?
Okay, I always thought that the reason that law was put in place was so that it makes it difficult to afford it. I hadn't actually thought that it has to do with children buying. So currently, depending on where you're buying, I think a packet is 300 to 600 shillings a pack. based on economic reality, not many people are going to buy a packet for that 300 shillings. I think the opening it up to sell sticks won't solve the problem. And really, we all would want to move people towards, for lack of a better word, reasonable consumption if they must. And as we work with it, maybe work towards reducing the amount of tobacco being consumed. I don't think it needs to be reviewed back to what it was. What I think is, and I think again it has been alluded to by the doctor, is really have proper stakeholder engagement in ensuring people understand why that law is there. That is one. The second thing would be, as with many things, success is based on the knowledge of a consumer. So how are we engaging those consumers? Vis-a-vis arresting me because I bought a stick of cigarette. Has there been engagement that educate? Yes, we say carcinogenic, that word. Carcinogenic. Is, yeah. I mean, for health purposes, there really should be an element of reduction in how much cigarette is being consumed. And if the world across is using nicotine to start moving people away from tobacco, then maybe that's the way it should. So the law we're looking to amend should be speaking to promoting that as a cure, but with proper stakeholder engagement so that we're all on the same page. If we just use the stick all the time, we're currently almost at 50% illicit cigarette sales. South Africa is at 70. What we're doing is effectively killing a business that not only feeds the government, but keeps very many people able to continue serving their families in terms of food, clothing, education, etc. So I think the law should be looking, and I think that's what the last thing that Janet has read is speaking to, ensuring that there is a ground that allows everyone to be able to perform as per the law and ensure that we are all being able to play our part in building the economy.
Right. Was RETRAC, and I'll ask the same for the Society for Harm Reduction, were RETRAC and Balita part of public participation at any point with the current bill as is? Was there any point of the process where you gave your views, and were they incorporated into the bill as is right now?
If I go first, definitely not enough public participation. We did not participate in this one. So that is our first ask. Can we have effective public participation before the bill goes any further?
Okay. Let me ask the same of Doc. And did you make any proposals? Was there public participation? Was any of that included in the bill?
Yes, we did make our proposals to the bill, but definitely the public participation was extremely inadequate. It was a matter of hours, and what we requested was, can we have a more engaging public participation that has a national appeal? At least we need to hear voices from each county, to have this public participation effective. So as a society which promotes the safety of tobacco users and how best they can be assisted to quit smoking, that public participation was inadequate. It needs to be more engaging.
Okay. I need to go now into ideal regulation, and previously we had used the UK as a very good case study. I think you've also used it. I'd seen it on documentaries separately, and even just looking online, it does seem to be one of the best case studies for nicotine, e-cigarette, vaping, all of that regulation. But what do you think ideal regulation would look like? If you were asked properly, this is our public participation, as far as nicotine is concerned, what proposals would you give?
Yeah, as a harm reduction society and from a medical angle, we have two basic tenets. And what we are trying to say is that we need the concept of harm minimization incorporated in the bill. And most importantly, we need a bill or a law that is based on science, not ad hoc decisions, because one of the reasons why implementation is becoming very difficult is that we are not getting enough scientific evidence to back this bill. And we as a society are saying that we need to engage more and incorporate these two pillars of harm reduction and see how best. It is high time. We must recognize that tobacco users are addicted to nicotine and they need help. And we must continue engaging the public and telling them that, hey, please, if you don't use tobacco, please don't start. And if you do, you can be assisted to quit.
Dr. As a society that's very much involved in these conversations, do you have a specific clause that you'd like introduced or removed from this bill?
Or amended.
Or amended?
Yeah.
And how would you like it to be worded? So
Yes,
let's introduce the concept of harm minimization into this bill.
Absolutely. The very first thing that needs to be done is to define tobacco control. It is not defined in the Act. And as I said, way back in 2007, the Tobacco Control Act was actually lifted from the WHO's Framework Convention for Tobacco Control. And the definition of tobacco control was purposely omitted. So let's begin there, because at that level, it will address demand, supply, and harm reduction strategies. The purpose of WHO recognizing harm reduction was because they knew, or they had studies to show that people use tobacco. I mean, that's a fact. And how best can they be assisted to quit? And how best can the harm from tobacco be minimized?
Okay.
So that's a very key component. The second component that we need to have amended in the bill is to distinguish nicotine from tobacco. As I said, nicotine is not tobacco and tobacco is not nicotine. And that's a scientific I mean, there is a lot of scientific evidence to show that. That's a scientific statement. The other thing is that we need to have smokers recognized in the bill with a view of assisting them to quit. In other words, what I'm trying to say is that we must have the health component of assisting smokers to quit. How do we assist smokers? I mean, there is no much framework or a very clear policy on how smokers should be assisted to quit tobacco. And if that is considered, then we'll be headed in the right direction.
So if we did that, what would the bill then look like? What would it say? Because I'm hearing what you're saying. In the definitions, let's add their definition of tobacco control. Let's define nicotine and distinguish it from tobacco. Let's do all those things. So in the bill itself, which is seeking to say, let's regulate how people access, let's regulate, what change would it have?
Yeah, it will definitely have change in as far as policy is concerned. Because once you have the bill recognize this concept, then it goes to the policy formulation. The policies will be guided by the Act, if at all it is passed through. And in the policy, either by Ministry of Health and other stakeholders, it will have to recognize these concepts and at the same time see how best the children and youth can be protected. So it's the impact
that it has.
that it has.
I wanted to see if Wambui has, oh, sorry, Mariam.
No, same thing.
Yes.
To hear her proposal.
Yes, amendment, addition, what you'd remove, yeah.
I think for us, ideal regulation would balance between the public health needs of society and the interests of all other stakeholders, including all the small businesses that do tabletops or the smaller kiosks. As it is, the bill kind of leans only on the public health angle and does not accommodate all the other stakeholders we're therein. So for us, ideal regulation would really be a balance between public health and supporting continuous business. And then I just wanted to note that on the issue of public participation and whether views were accommodated, for those who submitted. I think it's worth noting that the committee's report is also not yet out. So it would even be difficult to know whether any of the views that were submitted have been accommodated within the amendments.
Okay. On your end, was there a double taxation issue with the recommendations of the bill as is?
Yeah, remember I mentioned that one of the things that the amendments are tending to put in place is giving the county authority to license who buys, who sells tobacco, similar to what we have with liquor. In the informal sector, one more law is really almost a death sentence to a business. People are not making enough to be able to pay. And the unfortunate thing about county laws is that there is constant lack of clarity around it, which creates a lot of rent seeking with those on the ground and the implementers. So one more tax, one more levy just makes business that much more difficult, and may result in there being closures. And I have to throw this in that, remember, we are operating in a better economy, bottom-up economic transformation agenda. So really, we should be looking to support and minimize the cost of doing business for the people at the lower bottom to ensure that they're able to grow their businesses.
Okay. I want to ask both of you, and I'm thinking about this from a public perception point of view. We can push for the bill to distinguish between nicotine and tobacco, to do all these things, but if the public isn't aware, because a lot of us, nicotine, tobacco, same WhatsApp group, you don't distinguish the two. Yeah. So if the public isn't aware, then there's still a really big gap. So perhaps, Wambui, I don't know from Richard's perspective if there's anything being done to also educate on the use of nicotine as a way of quitting cigarettes and a form of harm reduction, and the distinct.
It's something we aspire to do. Limitation is that the law almost wants to ensure industry players, especially the manufacturers, are not seen, and they would be the best people to educate, working together with public health department to educate the consumer. As I said, everything for me and the effectiveness of any law or any standard that we want to put into play really relies on the consumer being on the table and understanding why something is being done the way it's being done. So yes, we would aspire to, and we do have engagements with public health to talk on the same, but I think it would be even more effective if we got all players on the table to be the facilitators of that consumer stakeholder engagement.
All right. Doc, what about you? The society, what work is it doing as well to make sure the public knows all these things?
Yes, we've been engaging the public. We've been engaging professionals, doctors, lawyers, and the general public at large. And we mainly focus on smokers, telling them the dangers of smoking tobacco and how best they can quit. It's quite interesting to point that most clinicians don't know how to manage tobacco use. And one of our clarion calls to the Ministry of Health has been, can we have a department called Stop Smoking Services Department? So that we focus.
There's one in the UK, yes. It's literally called Stop Smoking.
Yes. So we've been calling the ministry as according to the law as it stands, the industry is not allowed to participate. That mantle has been taken by the Ministry of Health with resources. It's important to note here that 2% of all gross sales derived from tobacco goes directly to the ministry. It's a special tax called solatium. And we have been asking the ministry, you need to enhance more of public awareness. There is enough funds to establish this Stop Smoking Services department run by the ministry. You need to educate clinicians how to manage people who are smoking, and even make available those products that are approved by the ministry to assist smokers to quit. And that has been our clarion call all throughout that the ministry needs to take action.
Yeah, on the
Currently, there's a desk in the
Yeah.
ministry that deals with tobacco.
And if I can
business.
jump in there and say, I think when industry players were removed from the scene, the mandate to educate the public fell squarely on the Ministry of Health. So really, they do have a task over and above. And again, as I spoke earlier, of bending towards just the interest of public health. They really then should come out very aggressively in educating and engaging consumers of cigarettes to educate them and better make them understand what are their options, support them, as the doctor says, in terms of attempting to reduce their consumption.
I want to ask the direct question here. We have many e-cigarettes, pouches, and shisha and other products that are being sold in the market. Daktari, do we know whether these things are safe?
The answer is
vapes and all that are being sold, some even in formal market spaces.
the answer is no, we don't, because there are no standards that have been set. As we speak, which the bill is trying to achieve, we don't have measures, toxicological measures of what is in these products. Quantification of nicotine is missing, which the bill is trying to address by giving the Cabinet Secretary the mandate to initiate the toxicological measurements, which should be done by the Ministry of Health through the Quality Control Lab. And those are some of the positive things about the bill, because the bill is attempting to set standards for purposes of making these products safer, so that if those products that do not meet the standards, then they should not be in the market.
And we'll get to Wambui's response. You know, I'm just thinking, we're hearing a lot of comparisons with what the UK is doing. I think South Africa at some point had tried tax hikes as an approach. I wonder what lessons we can draw, because it's not a blanket solution. So we could say, for example, stop smoking centers. But I think if we're thinking about culturally who we are, how we consume information, how we consume messaging, I'm just wondering whether there's any lessons that we can draw from other countries already doing it, so that we avoid unintended consequences. Because you might try to implement something, but it goes over people's heads because, oh, it worked in the UK. How do we then begin to edit it to make sense for us? So maybe I'll start with you, Wambui, just thinking through, just the approach that would make sense for our market, even though we're trying to quote unquote benchmark, if that's the word I can use, but it could have unintended consequences.
You know, we are always, any economy, any industry is always aspiring to catch up with best practices. And best practice, I mean, tobacco is smoked across the world. Tobacco, nicotine is smoked everywhere across the world. And there have been measures in all countries to try and manage it. So we cannot cut and paste, because as you've said, culture varies. How we go about our smoking is very different, perhaps, with how it happens in the UK. I know part of the challenge would be, again, knowledge, especially of those who are consuming. So whatever aspects we take, can we then first educate people on them, try to apply them based on our circumstances? I'll give you a perfect example. We've been having a lot of back and forth with music copyright people. And they've simply taken the rates in the UK and want to apply. We have an extremely different economy in terms of value. So the same thing with managing our tobacco industry. How do we get the best practices but are able to implement based on our own circumstances? And a ban never works. During COVID times, I think one of the things, the measures the government in SA tried to do was to ban the sale of cigarettes. The net effect is what I mentioned earlier. We are upwards of 70% illicit trade in tobacco in South Africa, and we don't want to get there. I want to pick up on what the doctor was talking about, standards. And my question to him and to all of us would be, what then comes first? Because if we're saying we need to manage the nicotine products that are in the market, it means we are looking to manage the nicotine levels, I guess. It means there has to be a standard at which it will be measured against. So should we then perhaps look into putting the standards in place so that we then put a law to ensure people are living within those standards? Because if we go the route we're going now, how then what will we be measuring whether people are doing the correct thing or not, even in terms of the products that are in the market?
Right. Thank you so much, Wambui. We're just about to close for the hour. I think maybe just 30 seconds of a parting shot from Doc as well, and one from you, Wambui, as far as regulation of nicotine products, tobacco, vapes, e-cigarettes. What would be your one-liner to the policymakers?
My one-liner is we need to embrace science. When we are formulating these laws, we need to bring in the concept of risk continuum in as far as these products is concerned. And we can borrow some of the best practices, like in Japan. Some of the electronic cigarettes are prescription only. In fact, they have gone further ahead to protect their children. They are mandating their manufacturers to have biometrics in the electronic cigarette, so that it can only go on if you put in your fingerprint. So that if you have the electronic cigarette lying idle somewhere at your home, in as much as your child is likely to access, because we all know how children are very curious, they will not be able to light it up.
Okay.
So these are some of the proposals that we had suggested that need to be considered as we approach towards protecting our children and youth.
Right. Let's be rooted in science and in the data and in global best practice. Wambui, what's your one-liner for policymakers?
Banning has never been the solution. So in this case, banning things like the flavor of the nicotine will not solve everything. I think it will only encourage a more thriving illicit market, which will take away from legitimate businesses. So banning is not the answer. Let's work together to find a sustainable solution.
Thank you.
Thank you.
Well said. Huh?
Right.
Banning isn't the answer. That's Wambui Mbarire, CEO, Retail Trade Association of Kenya, RETRAC, CEO. And then we've had Dr. Kariuki, Michael, Secretary General, Harm Reduction Society of Kenya. In the next hour, again, we're tackling things that need to be regulated. We'll be speaking to Dr. Wairimu Mbogo, President, Pharmaceutical Society of Kenya. It is now coming up to 8 a.m. We'll have that conversation in just a moment.